Aortic stenosis is one of the cardiac conditions resulting from the narrowing of the aortic valve, leading to symptoms such as shortness of breath, chest pain, and even fainting. In more advanced situation, it even may cause sudden cardiac death. This condition doesn't just impact the quality of life of patient, but also it may shorten their longevity. Aortic valve is one of the four main valves in the heart. It's technically the outlet of the heart to the large vessel that supply the blood to the heart. Unfortunately, this disease, the aortic stenosis, is very common phenomenon. It affecting millions of Americans. What happened with this condition, because of the degeneration of this valve, it built large amount of calcium on this valve with time. Then slowly this valve became narrowed, and when it's too tight, it becomes so hard for the heart to pump blood out of it. That which result in symptoms for the patient. At Heart and Vascular Institute, we have wide range of options. Actually, our program stands out as one of the most innovative and comprehensive program for aortic valve disease. We are proud to offer the most comprehensive list of options to our patient, which includes the conventional open heart surgery, the new innovative way of replacing the valve with a small incision in the chest using the assistance of robotic arms. Also, we have the least invasive option, which is the transcatheter aortic valve replacement, or what we call it TAVR procedure, which I am one of the team members who perform this procedure on a regular basis. The TAVR procedure is designed to treat patients with severe aortic stenosis when they start feeling symptoms related to this condition. It's minimally invasive procedure to replace the valve with a new prosthetic valve. The way of performing this procedure, on the day of the procedure, it will be large team members taking care of the patient. Each team member is well acquainted with the patient and prepared to conduct their task on precision and care. The procedure itself involves inserting a valve mounted on a small catheter through minimal incision, often through the groin. We take the catheter to the heart to place this new valve in the place of the diseased valve. In some condition, when we don't have this option, we have alternative access to replace this valve through artery, either in the shoulder or in the neck. When we take the valve over a catheter, we place it inside the diseased valve. When we deploy the valve, it pushes the diseased valve to the side and anchor in its place. So we don't remove any tissue out of the body. And the procedure relatively short with very quick recovery. After we deploy the valve, we take the patient back to the recovery. Patients typically are up walking within a few hours, and many of them are discharged home less than 24 hours to resume their normal life. The patient will almost return to their baseline activity on the following day of the procedure. We have very minimal amount of restriction related to the procedure. Often we ask the patient not to lift heavy weight or drive in the first few days, but they can do their normal daily activities. And patient almost back to their normal level of activity within 1 week. Then we arrange to what we call it cardiac rehabilitation to confirm the fitness of the patient. Almost the procedure is pain-free. Surprisingly, some patients report to us they did not know even that we have performed any procedure on them. Also, one of the satisfying things we get from our patient, that they feel a big relief as far as their breathing after the procedure. A lot of symptoms they experienced for months and years, it almost immediately resolved after the procedure. This procedure started more than 10 years ago, and it started with patients who are not candidate for the surgical option. With the improvement of the safety of this procedure, currently we can perform it in almost all the patients. However, we try to select the best option for each patient depending on their profile, and we individualize their care to fit with the uniqueness of each patient. This procedure carry minimal risk with it. Major complication we warn the patient about is related to the access of the artery where we take the catheter to replace the valve. There is also small risk of having some abnormality related to the rhythm or the electricity of the heart, which can be treated with placing a pacemaker or other type of modality of treatment. There is also small risk of a stroke with this procedure, but also we are one of the center who use certain devices to protect the brain during this procedure. There are a few other minor things related to the contrast we give during the procedure and the kidney function, bleeding or infection. The risk of any major complication during this procedure depend on the risk profile of this patient, but they probably range between 4 to 5%, and the risk of having abnormality with the electricity of the heart, it's less than 10% depending on the baseline electricity of the patient. I know it could be nerve-wracking for the patient to undergo such a procedure, especially when it's involved the heart, but for us, this is not just a patient, it's a part of our family. So we treat each patient as a member of our family. For them, they may have this procedure once in their life, but we do this procedure routinely here. We perform this type of a procedure multiple times during each week. So we have the expertise to tackle the most challenging cases, and we have all the confidence to give the best experience and outcome to our patients. I would recommend to our patient, if they feel they are declining or they're not performing to the level they are expecting for their age, or they used to perform on that level in the past, to seek medical advice with expertise. When we discover this problem early, it makes all the difference in the outcome of these patients.